Hello! So, surgery is done and dusted. PD line is out. Yes! Woo! Yeah, I'll try and make it as short as possible without rambling on. It went fine. I was weirdly calm, which I never am getting GA. But because I think I feel so well, not because I think, because I feel so well, I actually wasn't worried at all. I got down, went straight into theatre, and as I was going in, they brought me into theatre 4. And number 4 I associate with Gary because Gary died on the 4th. Might be a bit morbid, but I use 4 for everything, and I see 4 as a lucky number, strangely. I don't know if that's weird or not, but when I see number 4, I was like, it's okay, Gary's with me, he'll be watching me, and I was fine. I got a little bit teary, but I was fine. Got in and we were chatting and talking, and I panicked at the last minute, but only because when they had me on the operating table, they put some mask, it's like a medical mask, over me, but she was squeezing it onto my face and it was really big, so I couldn't see out. But it tasted rank. I don't know what it was, and I was like, no. And they were like, no, you have to have it. And I was like, it was disgusting. And then I was like, I don't want to do this, I'm nervous. And they were like, no, you're fine. She's like, I'm just going to give you the anaesthetic now. And I was like, okay, please, no paracetamol or no painkillers, no fluids. And they're like, yeah, we know, Gillian, don't worry, we know your history, we know you're complicated, we'll take really good care of you, don't worry. And I was like, yeah. And then to myself, I was like, I am not going to go to sleep. I don't want this. I don't want it. Because I'd said to the PD nurse earlier, she looked and it looked okay. I was like, well, sure, I can go home then. I don't need to get it done. And she was like, get into that bed. You are getting it done. So I was kind of panicking because it looked okay outside this morning. But I was like, in my head, I was saying, there's no way, I'm not going to sleep. They won't put me to sleep. I'll be fine. I'm going to fight it. Yeah, I fought it for about 10 seconds. I was gone. And I remember when I woke up, oh my God, the pain I was in. Oh, I'll never forget the pain. Holy hell. It was horrendous. And my wrist, my as you can see, my wrist was sore, and I was like, And I seen the IV and I was like, what the hell? Why is that so sore? I couldn't understand it. But they gave me IV paracetamol. They wanted to give me oxynorm, but I'm not going to take any type of strong painkiller like that, not after the coma in December. So the IV paracetamol was fine. It took the edge off. Like I still have a little bit of pain and discomfort, but I'm fine. My hair is annoying me. Yeah, the surgeon's just been, and he's really happy. He said it was a little tricky to get out because it's clipped in a couple of places, so they have to blow me up with air to get in to get it. So they pull it and then snip it and pull and snip. And he said, like, sorry to gross people out, but he said it was quite mucky. I was like, oh my God, the shame. Like, it was not my fault. He said it's more than likely from lack of use. The stuff tends to sit there. So they've sent it off to get sampled and make sure, see what's on it. He doesn't think it's peritonitis because he said I would have been quite sick if it was peritonitis. But who knows? Knowing my luck, it was peritonitis. Like in ways I'm pretty strong and I can fight infection until it gets to the absolute worst. So yeah, he's happy for me to go home, but I can't go home today because straight after the surgery, my asshole lungs decided to bleed. Now, they weren't worried. They said it was more than likely the pressure from the ventilator. It stopped since. I was only coughing up a tiny bit of blood for maybe 1 to 2 hours. It's gone. So I'll be going home in the morning, which is great. I can't wait to get home. Physio was around and she was like, I think we'll just leave it today, are you up to anything? I was like, yeah, we'll do a walk. And she's like, you're after surgery? I was like, yeah, it's fine, it's grand, yeah. Can we do a walk outside? And she was like, okay. She was kind of, what the hell? So we got out and we did 3.5 kilometers. 3.5 kilometers. She was shocked. She was really happy. Like she said, I genuinely didn't think you'd be able for this. I thought a little tiny walk and get you back in because you'd be really sore. But she said, like, my God, this is incredible. Like, the endurance. and that I was able to do it after GA and with like stitches and stuff. She couldn't get over it. But like in total, I've done 5 kilometers today because there's magic doors here, and I took a walk out the magic doors. I landed. You walk out the door, and then you just arrive in the Italian in Bianconi's across the road. You just land there, and I was like, what? I don't want to be here. What am I doing here? No. So I ordered myself a nice goat's cheese bruschetta and a cup of tea. Oh my God, it was gorgeous. And I was starving because I hadn't had any food since 10:30 last night. I had a little bit of trifle and a half cup of tea when I came back, but I was a bit like, bleh, so I didn't really eat it. And I was really hungry. So I've done 5 kilometers today. I am definitely back, and it's not going to be long until I'm running again. When my body can catch up, my body is still struggling, but when my body catches up, you ain't going to see me for dust. I'm going to be doing my running again, and I can't wait. Yeah, on my wrist, I said to the nurse when I got back, like, it's really sore. And she was like, really? I was like, yeah. She's like, it's cannula. I'm like, it's really, really sore. Will you pull it out? So she was like, okay. And she pulled it out. She was like, oh my God. I was like, what? The needle was about that size, like no joke. She said it was so big that it would have hit my wrist bone. So she said, no wonder you were so sore. Like, she said, that is massive, especially given your size. Yeah. Finally, like, Trikafta. Trikafta is a miracle drug. It's like, it's not a cure, because obviously I still have to take all my other medications and stuff. But, okay, when I say that, I take Bricanil nebs, and they can't get them in the hospital because it's not licensed here. And I forgot to bring them. So I've had no bronchodilator since yesterday morning, and I'm fine. Like, I'm grand. I was on 3 to 4 of those a day a month ago, and I still couldn't breathe. But anyway, always after GA, I would get really sick really quick, like that. Like, literally when I woke up, I remember physios coming up to do, like, after the hysterectomy and after my Nissan fundifications, the two of them, the physios were up to me in ICU. I didn't need ICU today. I went to post-op care just for about an hour and a half, I think, and then straight back down here. But I can remember physios coming up and I was off my head, trying to do a bit of clearance to get the gunk off my lungs, but I couldn't. But like, watch this, okay? What is that mark there? What the hell? It's a scar. Can you hear anything? No. If I'd have done that any previous general anaesthetic, all you would have heard was a rattle of mucus that was stuck there, and what was there was thick and sticky, and I couldn't move it for days. I mean, days. And then I'd have to take IVs for 2 to 3 weeks to clear the infection that I got after the general anaesthetic. And today I am fine. There's nothing there. It's like ooh, it's sore when I cough. See? It's like, what? Trikafta is a miracle. It is a miracle, and I cannot wait until everybody is on it. And Canada, I know Wales finally agreed a deal, but Canada, Scotland, New Zealand, there's so many other countries that don't have access to Trikafta, Kaftrio, whatever it's going to be called. You need to get it, and you need to get it now. I mean, I am bouncing. I have done 5 kilometers today without even coughing after a GA, and with, like, I have a wound here. Here, you can see it. It's like, all that brown stuff is from surgery. I'm not dirty. And I've stitches, and I'm fine. If this isn't testament to just how powerful Trikafta is, nothing will ever be. It's life-changing, and I'm only on it 3 weeks tomorrow. 3 weeks, and my life has transformed already. It's incredible. So bloody make it available. Just get off your arses. Stop the faffing about. Make it available to CF patients, because in the long run, you will save money, because patients aren't going to need to be hospitalised as much. I'm going to be out of here tomorrow, 2 days, and I'm gone. Before Trikafta, even on Orkambi, I would have been in hospital for 2 to 3 weeks after. So it makes perfect sense. It makes financial sense. Get your patients on it, they'll get better, they'll improve, less hospital admissions, less money. It doesn't take a genius to figure out the maths. Okay, that's it. Talk to you all soon. Bye.